I'm Dr. Chris Murtis. I'm a family physician that works for Carilion Clinic in Blacksburg, Virginia. One of the things that kind of excites me most about avoiding overuse of antibiotics is when I educate patients who for years have thought that they needed antibiotics to recover and get over their upper respiratory infections, sore throats, coughs, or colds. And once you kind of reassure them with a normal exam that really this is a viral infection for which antibiotics have no purpose and no benefit, and indeed actually have some significant risk as well as cost, what they find is that after they give it appropriate time, oftentimes 10 to 14 days, sometimes a little bit longer if you have a cough, that indeed they get better without any use of drugs or antibiotics, sparing them the side effects as well as the cost. In addition, it empowers them to know that they can get better without needing to see the doctor or seek medical attention every time they have a simple illness. So I encourage you to have that reassurance and to try to avoid antibiotic overusage. Thank you.
Hello, I'm Christopher Pierce. I'm interim chair of pediatrics at Carilion Children's, Virginia Tech, Carilion School of Medicine. I'm here to talk a little bit about antibiotic or antimicrobial stewardship. And what does that mean? I grew up in the world of medicine and we didn't really talk about this, but antimicrobial stewardship really is talking about what's the best use for antibiotics in particular, and what can we treat, what can we not treat. In the world of pediatrics, my world of medicine, children get sick a lot. The pandemic spared us an awful lot about children being sick, where they seem to stay at home and without picking up the typical viral illnesses, the other illnesses and whatnot. And of course, as we've emerged, we've seen what was called the tridemic, and we saw an awful lot of child illness coming back, things like RSV, influenza, which we had been spared for the last couple of years. And of course, our friend COVID remained around. And what this time really kind of is a good reminder that when children get sick, most of these are viral infections. They get a lot of the rough symptoms of fever, cough, congestion, feeling bad. But what it means when you get a viral infection is the antibiotics don't do any good. It's really a matter of keeping your child feeling well as you can throughout that, and healing them up through the natural process of the body healing from the virus. Antibiotics, we really want to reserve those for when you got a more significant secondary infection. Those would be the ear infections, the pneumonias, and some of the other respiratory infections, which are secondary to the viruses and relatively uncommon in the course of these typical childhood illnesses. In doing so, we also want to work with your healthcare provider to make sure that you're picking the right antibiotic, or they're picking the right antibiotic with you. You want to target just the infection at hand. You don't want to use overbroad antibiotics. When I think back over my years as a pediatrician, often parents will want, oh, I want a strong antibiotic, or I want to treat just in case. And really those strategies are just don't work. Treat just in case is going to probably mean that you're going to get a resistant infection if you do get an infection, which would mean we can't treat that infection so easily. The strong antibiotic does not mean better. Really, the correct choice for the pointed infection, exactly treating what you want to do, and only for the length of time that's needed. If I think of treating the children in the outpatient center, most of the infections, as I say, are relatively viral. Probably 85 to 95% of the time, antibiotics are not warranted and not needed, and to carry with them side effects. There's the antibiotic-associated diarrhea, along with some specific gut infections that can occur when you overtreat with antibiotics. And then on the global, the bigger scheme of what does it mean when we overuse antibiotics, what we get, basically naturally selecting bacteria that are going to be more prone to be resistant, because the bacteria reproduce so fast and they learn much faster than we do. They learn how to be resistant to an antibiotic faster than we can come up with new antibiotics. So the overtreatment basically means it's going to be harder and harder to treat your child, your family, the community with an antibiotic that will kill an infection that might be life-threatening over time.
Antimicrobial stewardship. Those were words that I never heard during my training in medical school. and neither in my training in residency. And times have changed because we have to be good stewards of our antimicrobial prescriptions and antimicrobial products. We were never given the tools in medical school nor in residency to actually tell people or help us tell people why we don't use an antibiotic in this particular case. We were given great tools about how to prescribe antibiotics and in which cases to use them. But I think that the time for a great conversation is now, has been for a long time, to show people, teach people, students, folks in training, as well as in the continuing medical education world, um, how we encourage good antibiotic use. I recall a case that I saw when I was a young attending, where a patient had taken a next door neighbor's antibiotics for what sounded like a viral illness, a cold. In this case, she actually had a significant reaction to it and sloughed off most of her skin. Ended up in 3 different hospitals in Norfolk, in Charlottesville, and in Roanoke. And the ultimate result was that she passed away from an unnecessary antibiotic. And it only takes one of those to convince us that we need to be good stewards of antimicrobials. And so I hope that with this particular project, we can encourage people to be better stewards. Thank you.